Today, we are going to look at a BodyViz brain builder about the integumentary system and burns. The integumentary system, or integument, is composed of the skin and its derivatives, including the nails, hair, and glands. The skin is one of, if not the largest organ of the body, and has many functions which include protection, synthesis and storage of lipids, excretion of waste, regulation of body temperature, synthesis of vitamin D3, coordination of immune responses involving cancers and other pathogens of the skin, and sensing environmental stimuli. The skin is composed of two layers, a superficial epidermis and a deeper dermis. The epidermis is composed of keratinized stratified squamous epithelium and comes in two types, thick and thin. Thick skin has 5 layers and typically lacks hair and is found on the palms of the hands and soles of the feet. From deep to superficial, the layers are stratum basale, stratum spinosum, stratum granulosum, stratum lucidum, and stratum corneum. Thin skin has 4 layers and lacks the stratum lucidum. The dermis is deep to the epidermis and is composed of 2 layers, a reticular layer and a papillary layer. The reticular layer is the deepest layer of the dermis. This layer is composed of dense, interwoven connective tissue fibers that surround blood vessels, nerves, hair follicles, sweat glands, and sebaceous glands. The papillary layer of the dermis, which serves to mechanically anchor the epidermis to the dermis, is composed of loose connective tissue and contains a large number of capillaries and neuronal axons. Now that we have learned about the integumentary system, let's learn about burns. Burns are one of the most painful injuries to the human body. Smoking and open flames are the most common causes of burns in older adults, while scalding by hot water is the leading cause of burns in infants and children. Burns are classified as first, second, and third-degree burns, depending on the depth of the burn injury. A first-degree burn is a superficial injury, in that it only affects the epidermis of the skin. The site of the burn is red, dry, and lacks blisters. Second-degree burns extend through the entire epidermis and part of the underlying dermis. The site of the burn is red, blistered, and often swells. Third-degree burns, also termed full-thickness burns, completely destroys the epidermis and underlying dermis. It is not uncommon for third-degree burns to also damage muscles, tendons, and bones. The burn site has a white or charred appearance. The burn victim lacks feeling in the area of the third-degree burn, as all of the nerve endings within the burn area have been destroyed. Next, we will look at the causes and treatments for burns, and finally, give a patient example. Burns can be caused by hot liquids, the sun, flames, chemicals, electricity, steam, and other things. Treatments for burns depend on the degree of the burn. For minor first-degree burns, running cool water over the area, applying lotion, and bandaging the burn are effective treatments. For major burns, immediate care from medical professionals is necessary. After first aid and wound assessment, treatment can involve medications like pain relievers and antibiotics to fight infection, wound dressings, which may either be dry or damp depending on the degree of the burn, therapy to help stretch the skin and keep the joints flexible, and surgery to help with blood flow around the wound, skin grafts, or plastic surgery. A skin graft is a surgical procedure where a section of healthy skin is used to replace the scar tissue caused by deep burns. Finally, let's take a look at a patient example. You are working in the ER and receive your patient's file and take a look. Age 27, gender male, chief complaint, extreme pain from a burn on his left arm. You step into the patient's room for an examination. Your patient is noticeably in pain and his left arm is wrapped in a wet dressing. The paramedics gave your patient morphine in the ambulance to help with some of the pain and covered the burn in a damp dressing. You ask the paramedics what caused the burn, and they explain that your patient is a chef at a restaurant and accidentally burned his arm with steam while in a hurry and removing the lid from a large pot that had steam building up inside. You carefully remove the dressing to examine the wound. You notice very red skin, with blistering that covers the majority of your patient's forearm. Due to the presence of blisters, and the fact that the patient is in pain, means that the nerves have not been destroyed. You identify this as a second-degree burn. You prescribe pain medication, ointment to prevent infection, and talk to your patient about changing the dressings. You want to see the patient in a week to see how the burn is healing and decide if other treatments, like a skin graft, are necessary. This is a classic example of a second-degree burn. Want to see more 3D anatomy? Check out BodyViz 3D Dissection Software, an online learning portal with active learning modules, automatic grading, real patient anatomy, and more. Click the link on our page to learn more.